This patient is about to have the minimally invasive non-surgical thread lift because she desires a little higher brows. It's going to be done with the Mint Easies. This is her before. I used tumescent local anesthesia, nearly 50 cc's of 0.5% lidocaine with epinephrine along the entire path of the scalp. We part the hair exactly the path of the needle later, and then we braid the hair that's in front so it doesn't get pulled into the incisions. Prep the scalp and the skin with some Hibiclens. Inject a little more local to the planned exits below the brows, as well as the actual entrances and the connections in the scalp where we're going to pass the Mint Easies. Then we make 4 1.5 millimeter punch incisions vertically above the planned brow exits, 3 to 5 centimeters behind the hairline. And then we make sure we pull out a little piece of scalp skin that the punch biopsy creates. And then we pass the Mint Easies from the center of one hole to the center of the other hole. And then we pass through the same holes, placing it subcutaneously through the forehead. You actually have to sort of push the needle down with your thumb and pull the brow skin up at the same time because to get around the curve. You cut off the needle. You do the same thing with the other end of the Mint Easy needle, passing it just below the brow, cutting the needle. And then you want to pull this brow skin, the entire forehead skin, up into the scalp so that it pulls the brows literally as high as they will go. And then you cut off the excess thread as short as you can get it, and then you release the dimple that is created right at the brow. And you repeat the procedure on the other side, once again passing the Mint Easy thread from the center of one to the center of the other hole. You pull the needles out so the thread is evenly on each side, and then you pass it subcutaneously below the brows, cut off the needle, and you do the same thing for the other one. Try to minimize any hairs that get pulled in with this. And then you slide the forehead skin up superiorly over the barbs, and then you gotta pull the hairs out of the incisions. And this is immediately afterwards. It is a little swollen for the next 3 hours because of the numbing. The Mint Easies are the only ones I find to actually be able to pull on the brow skin. Here you're seeing her 2 days later. You can easily make the dimples go away with either a little collagen injection or just pulling down on them slightly. But with the 2 Mint Easies, you can actually shape the brows. So 3 Mint Easies is going to make more patients happy because you can shape the brows, but the packages come in packages too. So you're stuck doing 4 Mint Easies unless they're doing like this patient, a mid-face lift at the same time, and use that extra Mint Easy to put one more thread on the left side of the face because the left side usually needs more. Now you're going to see the hardest thing when you're doing the 3 Mint Easies is going from one side of the forehead to the other. You go through a 1.5 millimeter punch incision with the hair all nicely parted, and you got to come out the same 1.5 millimeter punch incision about 1.5 to 2 inches over on the other side. You're going to find that it's going to spear all around it, and only after several tries will it actually come out the center of the 1.5 millimeter punch incision on the left side. But you keep adjusting it until it finally does come out the center because you don't want it to be stuck in the dermis. You want it to actually come out the center of that hole. And when it finally does and you see it coming out the center of it, you then go ahead and push it all the way through, and then you pull it out on the other side. Then you want to make sure that the thread is even on both sides, and that's where it's going to go subcutaneously. So I'm going to show you on the left. You go in that same hole. You make sure that you don't cut the thread, so pull it over the side. And if you happen to go a little deeper than sub-Q at the very entrance, that's okay. But you want to be sub-Q when you're in the entire forehead. But there's going to be a tendency for it to want to even spear the dermis as you go down, so you want to pull the brow skin away from the face, and you may even want to push down on the needle so that it stays off from spearing the dermis. You do not want to spear the dermis. It will cause some discomfort and be too palpable and visible. But anyway, when you do come out underneath the brow, you pull it through, cut off this needle, and then after you do the other side, you can pull them both tight and do as I showed you on the other ones. Here you're seeing a week later, the brows are initially quite high. They do end up coming down a bit, as you're seeing at 1 month later. This patient needs to have been told right from the start that she also needs an upper lid blepharoplasty, but only after the brow lift is completed. And now this other patient can have her blepharoplasty now that we can see how much skin we can safely remove.